let's talk about some of the common things that are tested on USMLE. The closure problems of the vertebral canal will lead to different types of spina bifida. There are 4 types that you need to be well aware of. The first and simplest of these, which is the most correctable, is the spina bifida occulta. The other types are known as spina bifida cystica, and there are 3 subcomponents of those. Remember that occulta is oftentimes more caudally located and will oftentimes only have the indication on the skin of the sacral or lumbar regions where there's a tuft of hair that exists. What happens with the occulta is that the spinal cord and the thecal sac are all within the vertebral canal, but the vertebral canal is not completed dorsally. With the cystica components, there is a cystocele in the thecal sac. With the meningocele, there's a lot of cerebrospinal fluid that is protruding from and out from the skin, but the vertebral column has no posterior neural arch formation portions, which has allowed this to happen. The important thing to know about the meningocele is that the spinal cord is still within the spinal canal. Therefore, these are fairly repairable, and children will still oftentimes have full function of their limbs. The more serious it gets, the longer the name gets. So we have a Meningioma Low Seal, and the Meningioma Low Seal is different from the meningocele, and it's worse because the spinal cord has left the vertebral canal protection and has protruded out into the cystocele that's been made because of the lack of the vertebral arch to contain it. These children oftentimes have spinal cord injuries, or their spinal cord is injured at the time of birth. The worst one, of course, is the schisis. Myeloschisis is the incomplete closure of the thecal sac, which exposes the neural tube and the neural development of the spinal cord to the amniotic fluid, and these children are always paralyzed beyond the point of the failure of closure.